Hello and welcome back to Casual Conversations. This is a video series presented by the Association of Cannabinoid Specialists that features panel discussions with clinicians and scientists on various topics related to the use of cannabis as medicine. My name is Christine Goedhart and I'm the Education Department Chair at ACS. I'll be the moderator for this episode's conversation, and I'm joined by our panel of cannabinoid clinicians, Dr. Suraj Tandon and Dr. Jordan Tishler. Today's topic is cannabis self-medication risk, and I want to begin by looking at why people self-medicate with cannabis in the first place, because this pattern it's really quite distinct from most other medical treatments, which are typically used under the guidance of a clinician. But many people who use cannabis for medical reasons are doing so independently without consulting a healthcare provider. So my first question for both of you is why do you think there are so many people choosing to self-medicate with cannabis?
Suraj, you want to take first whack?
Sure. And I'm speaking from Canada here. So certainly different routes of access and certainly with respect to legislation and laws. But I will say since there's been full, I would say, legalization of recreational cannabis use, that certainly muddied the waters with respect to patients who would otherwise have come to either myself or a cannabinoid physician or expert to seek consultation. Is that because of that ease and no longer having to go to maybe a specialist or a doctor, they're just going to the local dispensary because it's fully legal, and products, including even now medical grade products, are available within the local dispensary. And they're just finding it from, I think, an ease perspective that I could just go to my local dispensary. I don't need to go see my doctor. I don't have to worry about making an appointment, and I can just pick up something that I think might be appropriate. Or you may have someone quite young, a bud tender of some kind, who should not be providing medical advice or product selection based on, medical complaints. But I think that's the reason why patients are just going to local dispensaries. It's just convenient. It's easy. I don't need to. And they think, hey, it's just cannabis. It's a natural product. Why do I need to go see a doctor? And I think that's one of the biggest risks, but also one of the biggest reasons why I'm seeing many patients seeking sort of independent, medication selection.
I think that's absolutely key. And I think here in the States where the insurance issues become more at the fore, it's expensive. Even, if you're seeing somebody and it's some out of pocket, it may not be as much money as you would see the insurance company be billed, but it's still substantial enough that people kind of look twice at that. And then I also think that you sort of, to one of your points, there is this sort of long-standing sort of recreational attitude, which is it's just cannabis, so I'm just going to smoke some weed, and if it helps me with my back pain, that's great. And then I think, again, in Canada and in the US, where we've seen these recreational markets take hold, there's a lot of marketing, right? I mean, the reality here is that these companies make a lot of revenue and they reinvest that into marketing, which basically says, oh, you don't need no stinking doctor, just come to us and our 20-year-old will tell you what to do. And I think that, from a regulatory point of view, there needs to be some intervention there. But I think that that sort of encompasses a number of reasons, social and financial, that I think people are doing that.
Yeah. And I'd like to add, in addition to that, I would say just ease of access is not the only reason as to why patients are seeking to get medication themselves. I think the other things that I see often, again, because there's lack of training or education with respect to cannabinoid prescribing or authorization, especially amongst physicians, is that patients oftentimes they say, well, my doctor doesn't know how to prescribe it or authorize it, doesn't know the indications or the contraindications. And so I'm just going to go and get this product on my own, maybe with the support of a caregiver or my nephew or niece, etc., some family member who might be more knowledgeable about it than my own physician. And I think that's why it's so important that we do have courseware education organizations that can educate the masses, including all healthcare providers. In addition to that, I would say sometimes I get, again, because of the historical stigma around cannabis use, that many patients are sometimes afraid to go to their doctors in the first place to seek medical opinion about it because they're worried that their own physicians might judge them about considering this. And I think we have to, again, continue the efforts to destigmatize medical cannabis use, foster, important relationships between patients and providers so that they can get the appropriate and safe, prescribing support that they require.
I think those are really good points. I would also go back to that idea that doctors don't know what they're doing, which has been fostered by this industry because it's another way to discredit our medical guidance and shift that into their own arena where then they can guide people towards higher THC products, different types of products, and often sort of higher levels of use, which ultimately are not so good for the patient but may be very good for that company's bottom line. I would just say, look, even the most cannabis naive physician still knows leagues and leagues more about medicine and health and then the individual's medical conditions than you're going to find in the cannabis industry. The issue around physicians being judgy, I think there's some truth to that. I think that we as a profession and as an organization need to continue to push against that and say, look, we're not helping our patients if they feel afraid to talk to us.
Yeah, great. Thank you for providing some insight into why self-medication is so prevalent within medical cannabis. Now I'm curious, what do you see as some risks that people face when self-medicating with cannabis? And what advice would you give someone who's considering self-medicating with cannabis?
Well, let's start with the second question. And I would say my advice is if you're considering self-medication, don't or think twice about that. Because the reality here is in light of what Dr. Tandon and I have been talking about, cannabis is relatively safe compared to many other substances like opioids and benzodiazepines, but it doesn't mean it is safe. It is safer. And there are certainly ways that people can and do get themselves into trouble using cannabis. And part of our job as clinicians is not only to recommend a safe and effective regimen to the patient, but also to follow along and make sure that it's really working, but also to make sure that things aren't getting out of hand. And if they are, then to kind of help readjust into, again, a more effective and safer range. And I think that probably most of the people who know something about cannabis and maybe listening to this have heard the mantra, start low and go slow. And I would say that sounds great, it makes a great sound bite. But the reality here is what is low, what is slow, and perhaps most importantly of all, not included in this, is when do you stop, right? I mean, the most diehard stoner with the tolerance up to here presumably started down there, but they kept using more and more and more and never got the advice, hey, you know what, this is above the safe range. We shouldn't go this far. And that's how people develop tolerance, which leads to dependence and even can lead to a use disorder or addiction. So those are things that we want to avoid. The other thing is that cannabis, and more specifically CBD, which is certainly having its heyday, can cause medical problems, not just sort of that dependence and addiction variety, but also liver toxicity and drug interactions. And again, that's kind of our job to look at people and see what they're on and see what other illnesses there are. Cannabis can have negative effects on the heart. Doesn't mean that I wouldn't use it for somebody, but it means that I would want to know their history and talk to them about the risks and benefits and how we make sure that they stay safe. So I think that particularly if we're thinking about this in medical terms, where many of our patients are either middle-aged and sick because they have cancer or something like that, or they're older and they have sort of the myriad of things that older people get, like anxiety, insomnia, pain, etc. They're often then on a whole lot of other medicines, right, that really need to be accounted for in this discussion.
Yeah, I would agree with Dr. Tischler as well. I think, as you said, I would never recommend patients to just self-medicate for the most part, mainly for several reasons, which we commonly see. The risk of drug-drug interactions, which is often unknown to not only patients, but even providers. I've seen many oncologists unaware of the potential of various cannabinoids interacting with immunotherapy drugs or with anticoagulation or antiplatelets, where there's an increased risk of bleeding. So those are things in addition to the patients who have maybe other comorbidities such as coronary artery disease, or they've had a recent stroke. These are things that why it's important to be under the care of a medical cannabinoid expert to ensure that there's the right, the optimal and safe dosing for that patient. In addition to it, I think when patients may be self-medicating, sometimes, and I don't say sometimes, I would say often at times, we see patients who may take an edible, and because of the lack of awareness around dosing or unpredictable dosing or effect within the body, patients may say, "Oh, I didn't experience anything," and then they take another dose too quickly, and then leading to overconsumption and then potential toxicity. So just not having that awareness and having the oversight and guidance from an expert, we can often mitigate those sort of concerns and risks. And so I think, again, this is why I would say people should not self-medicate. They should at least always be assessed by an expert.
As a follow-on to that, I've certainly, in my practice, had people come to me who, say, "Oh, I've been using cannabis for 40 years," right? And they assume that they've sort of seen it all, done it all, know it all. But oftentimes, ironically, they're still coming to me because now they have back pain and the cannabis isn't helping their back pain. And what I realize is, first of all, they may have a lot of experience with cannabis in this sort of recreational fashion, but it doesn't really translate into a medical understanding. And then, of course, there's the completely novel understanding to them that the reason cannabis isn't working for the back pain is because they're using so much. They're thinking, well, it should be enough, right? But the reality here is that you can sort of go out the other side and, in fact, be ingesting, particularly over a long period of time, so much THC in particular that you no longer have adequate receptors in your brain. And then, there's sort of a limit to what we can expect it to do for you. And it's oftentimes I find a bit of a hard sell, but with patients where I've just developed enough of a rapport to be able to say to them, "Look, I think you're going to be both safer and you're going to get better medical value out of this if we can slowly bring your dose down." The times that the patients sort of agree or sort of finally grudgingly agree, and we manage to do this over 6, 12, 18, 24 months, they come back to me and they say, "I didn't believe a word you said, but you know what? Now that we've done it, you're absolutely right. I feel better. I'm sharper. I'm more with it, and my back pain is better." I'm like, okay, we understand the physiology of what's going on here, and it's just difficult to translate that into sort of a marketing piece. And then again, it's really our job to understand that and to be able to coach our patients, and to sort of help them understand that there's stuff going on that maybe even after their 40 years of use isn't readily obvious to them.
Right. And I agree. I'll add on to it. I think, yes, there are certainly, I've had patients who've been self-medicating for years, probably longer than I've been alive for. But also at the same time, what's important is to understand that the access to products, but also the concentration of cannabinoids over the last 100 years has also evolved. The products that people may have been using recreationally may have had lower concentrations of THC or other cannabinoids. Whereas now we see the introduction of sort of the medical stream, the full recreational stream, certainly here in Canada and obviously in the States, is that products and dosing and concentration have also evolved to more potent substances or more potent products. So I think it's again why it's important, as you mentioned, that you may have had patients in the past who were maybe getting some benefit and no longer but now recognizing with the support under your care that, oh, my back pain that I had experienced for some time previously wasn't responding to my, my homegrown cannabis. But now maybe with your care, the product that you've sort of suggested, authorized, recommended at this dose and this frequency and this concentration is actually much more effective. And that's again just because of the evolution, of potency over time.
We keep stimulating these ideas. It reminds me too that as these products have evolved through market competition, many manufacturers are now putting things in their products that are not from cannabis. And I've had at least one and maybe several patients who bought cannabis plus, shall we call them, products and actually have gotten sick. I actually had one woman who bought a product from a national US brand that was a mixture of cannabis and a rare medicinal flower called Corydalis, which apparently grows wild in the Himalayas, but is known in some people to cause liver toxicity. And this woman's liver function tests went through the roof, and she was sick and vomiting and all those sorts of things. And nobody knew what to make of it until I was talking to her. And I said, "Well, what have you been taking?" And she said, "Well, I've been using this product." And I went, it's not the cannabis, it's the plus. And we went and we sort of looked it up. We took her off the product. She got better. And then we were able not only to make her better, but also then to run this through some of the legal channels and get that product removed from the market.
Yeah. Well, thank you for talking through some of these risks. So it's obvious there are many risks associated with self-medicating with cannabis, and it can also lead to less effective treatment. The cannabis just not working as well. So I'm curious now, what would you like to see happen to encourage people to not self-medicate, to seek out medical guidance for cannabis care? What would you like to see happen to help address this trend?
Suraj?
Oh, um, I think the first thing is, as I mentioned early on, I think I've had many patients who've disclosed to me that they just either they're afraid of seeing their physicians or their providers because of being judged. I think the first thing we have to do, again, recognize that cannabis can be safely incorporated into, one's treatment plan, but it does require the support of a physician that's competent in understanding, medical cannabis support. I think as providers, we need to foster and welcome patients to ask us questions, to be open and feel that they're in a non-judgmental, safe environment if they are using alternative therapies, whether it be cannabis or other substances. But that's the first important thing. In order for us to ensure patient safety and also considering alternative therapies such as this, we need to have a very wholesome rapport with our patients and create a trusting relationship so that we can foster that initial discussion. And if the provider is not aware of the benefits or the side effects of cannabis use, or they don't feel comfortable or knowledgeable, then they should again make the decision to transfer them or recommend them or refer them to someone that would be appropriate. So I think that's the first thing, is just really, I think, spreading the awareness around it, that this is the best way to avoid ER visits or accidental toxicity or potential misuse or harm to animals or children. But also, sometimes patients may find the benefit, but they might mask underlying disease. Sometimes I have patients who've been consuming cannabis that, oh, either having abdominal pain and they found that, oh, it helped my pain, but then years later recognize that now they're having, there was maybe an undiagnosed malignancy that was being masked by the treatment of cannabis. So I think we just need to be very open-minded. We need to be respectful, and really stimulate conversations about the benefits of seeking consultation with your healthcare provider first.
Absolutely. One that I worry about is people who self-medicate for insomnia, but they're actually hyperthyroid, right? That's kind of one of those things that
Yeah.
we as clinicians would think about, at least in passing,
Yeah.
but there's no reason that anybody else should think of that. So I think you're absolutely right. We need to educate clinicians better, and that's all both about cannabinoid medicine, but also about sort of the approach to being inclusive. I think we also need to see um, governments that control these things start to do better outreach and education to patients. Cannabis is a bit uniquely positioned because it's really the only substance at the moment that I can think of that has both legitimate recreational and medical uses, right? I mean, alcohol is certainly recreational, but we don't use it anymore for medical. Opioids certainly can be medical and probably are not legitimately recreational. So this really straddles a fence that we don't have a lot of precedent for. And I think that from my point of view, the best possible outcomes are sort of to make a bright line between that and to say, look, if you're having friends over on Saturday night and you're going to make barbecue and you want to have some fun, then perfectly reasonable to go ask the bud tender what goes well with, ribs, whatever. That's fine. But if you have some sort of a medical issue, whether even if it's not something you would consider to be tremendously important, like insomnia, although I would consider that fairly important, or some mild anxiety or any of those sorts of things. I think that's where you really need to have that bright line and have people educated to think, you know what, I shouldn't take this for granted. I really should talk to somebody to make sure that I'm getting the right treatment and safe treatment, and also not running past any other illnesses that this could represent. Um, and I think that a third thing, which is sort of related to the physician education, is that I think that most of the countries and states that have brought medical to the fore have used this sort of recommending authorizing schema that we got inherited from California from 30 years ago. And frankly, I don't think that that's reasonable or viable any longer. That may have been necessary 30 years ago because of issues around illegality. But at this point, we as clinicians need to step up and really take some ownership. And I think that one of the key elements to that is moving from this sort of carte blanche authorization into a specific prescription, right? I mean, we prescribe every other medicine that we give people, and it does a few things. The first is it makes it very clear both to the patient and to the dispensing agent, pharmacy, dispensary, whatever, what it is that should be dispensed, how much, how it's to be taken, and all those sorts of things. But the flip side of that same coin is it makes sure that the clinician has to know what they're doing, right? It's very hard for somebody who doesn't know what they're doing to write that kind of a specific document, and particularly because then it's also a legal document. There's some medical legal ramifications of making sure you do it right. So I think that it's time for various governmental and regulatory agencies to sort of shift the model when it comes to the medical side of things, from this sort of like, here's your card, go get some weed, to, your doctor wrote you for this, and with the instructions like that, and just like we would be doing for penicillin or a statin or a blood pressure medicine, or fill in the blank.
I will say I appreciate you making that comment, because I've seen a change where here in Canada, up until 2018, prior to that, in order for someone to receive cannabis, as an adjunct, as part of the treatment plan, they had to see, a physician, and the physician would determine the appropriate indication, dosing, possession, or quantity of possession, etc., and ensuring that there was appropriate follow-up, right? That's how we were able to track whether they were responding, whether they needed maybe a tweak to their dose, or whether there was any side effects, or there was any contraindications. But that was the best way to minimize a lot of the harms that could come from cannabis. Now, and I've seen, since that has dissolved and we've introduced the recreational market, it's a free-for-all. We've lost the ability to not only provide safe and adequate care, and allowing and entrusting patients to self-administer and self-medicate has created substantial harms. We've seen an increase in ER visitations because of that. Or we've seen patients who may have legitimately could have benefited from cannabis use. However, because of maybe an improper dose in the beginning or an adverse side effect, they stopped it and they report saying this was a failed treatment response, right? These are things that could have been mitigated and avoided had they have appropriate supervision from day one. And it's unfortunate that we've seen the change here in Canada because that has not only muddied the water with respect to appropriate patient care, but also it's muddied it with respect to doing higher quality studies. Especially we wanted to assess these patients longitudinally. That has now really complicated and has masked the appropriate evidence that we would be seeking, especially when you have these recreational users, medical cannabis users all in one hat, and again without any oversight. So I agree with you that there needs to be definitely some governmental organization or regulation with respect to, you know, putting in some sort of safeguards with respect to self-medication. I wish we could go back the way it was before,
Yeah.
because I certainly saw significant benefits in patients, but now the fact that they've been self-medicating on their own, I worry often at times.
Yeah. You know, another issue that occurred to me as you were speaking is that the self-medicators, generally speaking, are sort of accounted for in some ways. That is to say, using US numbers, because those are the numbers I know, our estimates are there are somewhere between 20 and 30 million Americans who use cannabis for some purpose, right? Could be medical, could be self-medication, could be recreational. But the total pie, if you will, is somewhere around 30 mil. And from an industry point of view, that's a nice looking piece of pie that you could get a slice of. But I'm always quick to point out that the real problem for us is that there are about 200 million Americans who are of the age to have and or develop amenable problems. And most of those people clearly are not self-medicating, just not getting access or supervision. And that's a problem because, it's a problem because they're not getting treatment, but it's due to the fact that, again, their clinicians aren't educated enough to say, hey, Mrs. Jones, before we put you on opioids, let's try cannabinoids, right? And even less so as this recreational self-medication stuff comes along, because those who will self-medicate won't ask their doctors, but those who won't self-medicate look at this and go, oh, well, that really did turn out to be just for potheads, right? So I'm not going to ask my doctor. And if my doctor's not going to ask me, then that conversation just never happens. And then we've got, whatever that is, 170 million Americans getting nothing for their back pain. And I'm sure that, those numbers are only worse when we start to look, globally. So I think that having that more buttoned down, more medical, more conventional approach, coupled with education for both the public and the clinicians, is really the way that we're going to be able to move the needle towards getting care to the people who need it.
Absolutely.
Great. Well, thank you, Suraj and Jordan, for sharing your insights on the topic of cannabis self-medication. And for those of you watching, I want to thank you for taking the time to listen to this conversation. If you're interested in learning more about cannabinoid medicine, please check out the education section of the ACS website, which includes videos, blogs, and courses on a variety of relevant topics. And if you aren't already, please consider becoming a member and joining us in the effort to advance evidence-based cannabinoid care and to shape the future of medical cannabis through education, research, and advocacy. Thanks again, and I'm looking forward to seeing you next time.